is diagnosed with breast cancer at some time in her life, but men can get breast cancer too. Hartford Healthcare Dr. Valerie Brutus of the Cancer Institute at St. Vincent's Medical Center is here to explain more about men and breast cancer. Doctor, welcome.
Thank you for having me.
Great to have you. So why is it important to raise awareness?
It's important to raise awareness because it allows cancer to be detected at an earlier stage when it's easily treatable. Everyone should be familiar with the way their breasts look and feel. Unfortunately, many men are unaware that they can also be affected with breast cancer.
Doctor, how often are men diagnosed with breast cancer?
It's very rare. So in the United States, the lifetime risk of a man to have breast cancer is 1 out of 800. This year alone, about 2,700 men will be diagnosed with breast cancer, and about 500 of them will die from breast cancer. So the overall death rate in diagnosed account for 1% of total breast cancer cases.
And doctor, what are the risk factors?
The risk factors are similar to women. So increased age, with the average age being diagnosed is above 50. Having a family history of breast or ovarian cancer, having a genetic mutation, specifically the BRCA2 genes, put someone at increased risk. And also, obesity, heavy drinking, having, there's a condition that's called Klinefelter syndrome, where someone has an extra X chromosome that can also have them at increased risk, and having radiation to the chest wall as prior cancer treatment.
And doctor, are there screening guidelines for men?
So currently, the men at average risk do not need to be screened, but if a man is a carrier of a BRCA2 genes and has a condition that's called gynecomastia, where the breasts are enlarged, it's recommended that this person consider to be screened with a mammogram at the age of 50 or 10 years younger than the first male relative was diagnosed with breast cancer.
All right, and doctor, tell us about the symptoms for men with breast cancer. Are they similar to what we hear women experience?
Yes, so the most common symptom with the men is going to be a painless, breast mass. Other symptoms can include dimpling of the skin or some scaling of the nipple or discharge from the nipple. So these are the most common symptoms. Sometimes, this can also present as a mass underneath the armpit. This is where the cancer has already spread. Less common is going to be some breast pain and some heaviness of the breast.
All right, and doctor, finally, talk about treatment. What are the treatment options for men?
So like women, the treatment is going to depend on how big the tumor is and if it has spread to the lymph nodes or not. So treatment is always going to involve surgery, and men, we can do mastectomy where the breast is removed, or we can save the breast as well. Sometimes we do surgery on the lymph nodes, and there's other treatments such as radiation, chemotherapy, hormonal therapy, and targeted therapy that are also available. The treatments are individualized depending on the stage and the type of cancer that's present at the time of diagnosis.
All right, Dr. Valerie Brutus, thank you very much for your time. We appreciate it.
Thank you so much for having me.